Hello, this is Dr. Scott Lamp with Roselle Center of Healing. We're going to talk about heart attacks and stroke. Welcome aboard. This particular subject is near and dear to my heart. My mom passed away from complications of diabetes, but a lot of vascular damage was happened to her. Just quality of choices that she did, lifestyle choices, and talking to the doctor, or only find the doctor who would only listen to her plans, not the plans that she's supposed to do. And then my father had a stroke that actually affected his speech to some extent. But what's interesting between the two, I couldn't help my mother. She passed away suddenly. It was something that was a kind of surprise. My father had a stroke, and I had taken care of him for about 6 years. Some of them might have seen him in the office when we were in the old building. And it was interesting to see when I could control his diet, control his kind of like his exercise and put a program in place and have a very compliant patient, he survived longer than the medical doctors would give him. They said because he smoked and drank and the amount of clotting that was happening in his body, he wouldn't be able to survive long, or he would have high blood pressure or have diabetes. He had none of those, but a strict control of his diet worked well. What actually eventually took him out is he had aspirated on a piece of food and he struggled, and he did have a stroke from that point, but it was an immense reaction that took him out. Now, our heart is like a locomotive. It's supposed to be taking oxygen and delivering it to the cells, and the tracks are our arteries. The arteries are supposed to be straight and repaired and working well so you can actually deliver fluids throughout the body. And what happens is it's kind of much like one of the problems we have is we disrupt those tracks, we have problems. And if that happens, the heart has to work harder, and sometimes it goes off the rails, and we definitely don't want to have that. Here's a large list from somebody I really well respect. Is Mark Houston. He's a cardiologist out of the University of Tennessee, and he lists the 25 chronic heart disease factors that play a part. And you can read through those, but there's a lot of interesting things. There's a lot of things that have to deal with handling of sugar. Because one of the things you'll notice as we talk through this is that there seems to be, when you have insulin resistance, there's a resistance of getting magnesium or potassium or other substances into the cell. And when they say they're unknown causes, I think there is some causes. If we really work on our diet well, a lot of these things start to clean up. Of course, this is a disease process, heart disease and strokes and things, huge amount of money, $322 billion a year, as you can see out there. And about 80% of the heart diseases, heart attacks, angina, coronary heart disease, congestive heart failure, can be prevented. Now, heart attacks are really of kind of two types. One is actually one that's actually ischemic. You've kind of blocking the blood flow getting to the heart itself, and that's where you have the ischemic heart attack here. But then also what happens is the difference between that and a cardiac arrest. That's when the heart actually stops, and that's a sudden, unexpected cardiac arrest, and the third leading cause of death in the United States. In the first part of the paragraph, you'll see that a heart attack will remain unconscious with the heart beating, while a sudden cardiac arrest will be unconscious. There's no discernible heartbeat. And if you go down to the third one, during a cardiac arrest, the electrical system is impacted by physical conditions such as cardiomyopathy, heart failure, arrhythmias. A heart attack will also increase your risk of having a sudden cardiac arrest, since the loss of oxygen supply will affect the electrical system of the heart. When you talk about electrical systems and we talk about electrolytes, there's an important thing going back to nutrition and how the body conducts certain things. And do I have the electrolytes, let alone the plaquing that might be involved? So again, we're looking at what's the quality of the arteries, how they impact flow, but also how they impact the electrical part of the body. On the bottom here, it says loss of oxygen in the heart muscle from a heart attack affects the electrical impulses and may trigger a cardiac arrest. Factors associated with heart attacks: age is definitely one. Cholesterol levels can sometimes be debatable. Diabetes, especially insulin resistance, plays a big part. Obviously, diet, if I can't get the right minerals to repair my body. Genetics play a part. Heart surgeries and any other type of surgery that you have could produce clots. That's one of the things on, let's say, hip fractures and those kind of things. Hypertension. If I got injury to those tracks and I'm pushing the tracks, you definitely can cause some problems there. Obesity shows inflammation, previous heart attack, previous weakness. Smoking deteriorates the arterial walls, and then stress itself. Hypertension plays a major part with high blood pressure. As you can see, 1 out of 3 people seem to have it. Into 70 million people in the U.S., 1 out of 3. It also seems to be one of the leading causes of cardiovascular disease worldwide, and also the silent killer. Other complicating factors: diet soda and energy drinks, artificial sweetening drinks, caffeine-loaded energy drinks can cause the blood to get sticky and causing raising its resistance and putting pressure in those systems. Stress: the more stress, the higher the rate of stroke. There's something called the adrenal gland that has an effect on the coronary arteries and kind of close them up a bit and constrict them. So can the bronchial tubes, also being with the adrenal effect. We'll talk about that later. Hormone replacement therapy, increased risk of clots and heart attack and strokes. Think of estrogen that's sometimes also playing in the birth control pill. Vitamin D, low levels doubles the risk. Normal is 60 to 80 nanograms per milliliter. But if you go to your standard one, the standard medical model, it's 30 to 100. I find that 60 to 80 on functionally healthy individuals is a better number to go for. Strokes are the leading cause of long-term disability in the United States, and worldwide, stroke is the second leading cause of death and the third leading cause of disability. If you have 3 to 5 risk factors for stroke, such as high blood pressure and diabetes and smoking and obesity, you increase the aspect, obviously increasing the aspect of stroke there. Rapid treatment is imperative. As noted in the Journal of Stroke, the ideal treatment window is within 3 to 6 hours of onset, and even then, 5% end up with long-term disabilities. Now, stroke happens when you have a blood clot going in the artery and blocking nutrition and oxygen to that particular area. Could be also a rupture of that artery, the artery being damaged that way, and the sequelae of this could be lethal. It's interesting to see, and especially in the third paragraph here, is surprisingly blocking inflammation after a stroke isn't necessarily beneficial. Brain inflammation, because in the inflammatory process, following a stroke actually plays a beneficial role in the neuroplasticity, is in restoring the function, neuroplasticity of the body. The brain is plastic, which basically means that it can adapt and change, but it takes some time to be able to do that and kind of recover. Brain needs rapid implement of neurocognitive training after a stroke, as your brain circuits need proper stimulus to reroute. What you need to know about the brain is simply this. It needs oxygen, it needs nutrition, it needs stimulus. If it doesn't get stimulus, or it can learn not to do something as well as learn something. Sometimes when somebody has a stroke on one side of the body, they put an oven mitt on the good hand to force the bad hand to work, or the body will learn to adapt not to use it. In our office, we look at 3 basic parts to any type of problem that happens to the body. Biochemistry. Are we lacking something in the chemistry department? Could it possibly be a chemical thing? Could it possibly be something even acupuncture can actually affect on that side? What stresses are you on, and how it affects the adrenal glands, and how the body can sometimes be in flight or flight mode or try to protect itself, but at the same time turning other things off. Structure are going to be the parts. In this case, we're talking about arteries, we're talking about the heart, but also what the other organs are doing, or bones or muscles, the hard tissues of the body. If you're sleeping more than 9 hours, or you're sleeping less than 6 hours, then the possibility of the risk of stroke is higher. So coronary artery, heart failure, and ischemic stroke are all raised at that point. Also, if you have genetic predisposition for insomnia, that's also going to be the possibility of increased risk of stroke. Stroke signs, if you don't know them yet, F-A-S-T, fast, face. Again, if ask the person to smile, if they can't smile and it kind of seems to drop down, possibility of a stroke. Arms, try to ask them to put the arms overhead. Do they drop down to their sides? They can't lift or they drift downward. Speech, is it slurred? You couldn't understand them. There's something they can't say a simple word. Or that's what happened. That actually happened to my father. Can't say, ask him what the spoon looks like. And he says it's a fabula. And it's like, okay, there's something wrong there. And of course, at that particular time, timing is essential to get them to the hospital as soon as possible. Additional signs: sudden confusion, eye vision, double vision, severe headaches, nausea, and vomiting. As we said before, 2 types of stroke: ischemic, it blocks things. Hemorrhagic stroke is actually when the the blood vessel ruptures. Exercise is always going to be beneficial for both heart and strokes, and actually improve physical recovery and mental ability, so on and so forth. But I want you to look at the study in 2013 published in Stroke, concluded that walking at least 3 hours per week reduces stroke risk in women better than inactivity, but also better than high-intensity cardio. This may have something to do with the amount of physical stress conventional cardio has on the heart, and that people generally do too much for it for too long. Perhaps women are more susceptible to these risks than men. Conventional cardio can cause arrhythmia, in some cases atrial fibrillation, which is also a known factor for stroke. And then in 2009, a study in neurology found that vigorous exercise reduces the stroke risk in men. So the difference between the sexes play a part, as well as helping them recover from a stroke better than faster. However, moderate to heavy exercise was not found to have a protective effect for women. Then there's silent stroke. No symptoms or damage, but you can have some memory damage that's happened here, and sometimes that's not seen right away. 14 times more common. You can take a look at the risk factors. A lot of that has to do, again, with sugar, as we'll get into more of the sugar element and how it affects the arterial walls. How we measure hypertension is blood pressure readings. First reading is systolic one, is the contraction of the ventricles going out, and the diastolic is the atrial actually filling up. Average is 100 to 140 to 60 to 90. If you get above those, you get into different chronic elevations and beginning of hypertension. Now, it's important to do like 3 separate readings to make sure it's consistent. You know, you got white coat syndrome that happens with some people. It might be the difference between a couple machines. And also, when you take blood pressure, it's good to be able to do it in 3 different positions. One laying down, one sitting, one standing, to try to check how well the body adapts from sitting to standing position. Some of the blood pressure should go up. It's a way to test the adrenals, but if the adrenals are failing when you stand up and the heart rate doesn't go up, then you might have an adrenal problem going on because of exhaustion. 2 types of hypertension in the medical model. The primary ones is 90 to 95% of the cases. They call it essential hypertension. And essential hypertension means unknown, so they're trying to treat you for unknown causes. The secondary ones are ones they do know. It's a chronic kidney disease or a narrowing of the artery, maybe an endocrine disorder, or pregnancy. High blood pressure can commonly be known as the kind of asymptomatic silent killer. You get headaches. That's on the back of the head. If you hold the back of your head in the morning. Dizziness, vertigo, fainting could be involved with this. Tinnitus or tinnitus, depending on how you want to pronounce it. Vision distortions, and then regular heartbeat. Other considerations include, especially a cause of secondary hypertension is going to be sleep apnea, and also too little or too much sleep, and we talked about in the considerations how that also plays a part in stroke. Readings can fluctuate from day to day due to such factors as the stress, the physical activity, caffeine, nicotine, proper fitting cuffs, lack of calibration, human errors, so on and so forth. Of course, untreated, you can lose a stroke and heart disease, as we're talking about, eye problems and pressure into the eyes and rupture and hemorrhaging in the eyes, as you can see in the second picture over, the aneurysm, kidney damage. When it comes to heart attacks, there's a lot of differences between men and women. And again, you should become familiar with this, and this is a good thing, there's a slide to understand. Men usually have the blockage form, and that's going to be like a tightening, like an elephant is sitting on their chest. And it says men are more likely to have that kind of reaction. Women is a little bit differently. They usually have an inflammatory base that kind of closes the artery to the coronary arteries, and they can have abdominal discomfort. They're going to have neck pain and shoulder pain, upper back discomfort, stomach pain, nausea and vomiting, and shortness of breath. And just to make the point, if you feel like you're having a heart attack, don't have somebody drive you, because sometimes you need electricity and you need adrenaline to get your heart going again. And all you're doing when you're doing compressions with CPR is just making sure the blood flowing to the body so the body doesn't die. A majority of the time, all you're doing is just trying to keep the body fluid so it doesn't become stagnant. So it needs those things to get to the hospital. Get them in an ambulance. That's the best way to go. Another sign of heart disease is the Frank sign, and we just see a little crease at the bottom lobe of the ear. The Corus CAD is another way to take a look for the possibility of predisposition genetically for heart disease. And if you're having some problems and you follow on the very bottom paragraph where it says who are non-diabetic and who have no previous interventions, coronary artery bypasses, or documented coronary artery disease, and seem to be showing some signs of these, it's good to see if I have a predisposition. Family history also plays a lot in this too. These two tests are very important to actually kind of figure out what's going on with our bodies. And, we have these lab values and we have high cholesterol and they're supposed to put us on statin drugs. The problem is how is our heart really looking? And this actually looks as a window at our heart. And if these drugs are supposed to be working, is it really stopping the calcium deposits that are happening on our heart? So the calcium score test is actually an ultra-fast CT scan, runs about, if you pay cash, and asked to pay cash, about $125 or so, or even cheaper than with insurance. But it measures and gives you a score from 1 to 1,000. If you get into 400 to 300, 400, you're getting at higher risk on calcium being deposited in the heart itself. And you could probably reference that and say, if that's happening there, what's happening to my brain? So even with stroke people, it's probably a good idea to even take a look at that spot there. The other one is the carotid intima media thickness, the CIM test, is a preventive measure for heart disease. It's actually a good one for a baseline to measure what's going on in my carotid arteries to my brain, and then come back, follow a couple years later and do it again to see if I'm adding some more plaque. Do I have to change my diet? It's a good way to kind of open your eyes to see where your body's at. Now, this is something you could do at home. It's a 1-minute heart check, recovery rate. And what you want to do is work out, and I think there's a typo here. It says 70% of the peak workout, jumping jacks, squats, stairs, measure pulse after you've done that work for about 1 minute. And what you're going to do is do it about at 75% of your max. And you want to get the heart pumping really well. So going upstairs for about a minute, doing jumping jacks, doing whatever squats, anything you have to run in place, whatever it could be. Take your pulse after that's done, after doing that for about a minute. Then wait a minute. This is going to be your recovery pulse. After that minute, you're going to take another number. So how you get this measurement is you measure the difference between your peak pulse, is the one after your exercise, minus the recovery pulse. If the number is 12 or less, high risk that your heart is not doing very, very well. 13 to 20 is moderate risk, and 21 to 40 is good. I mean, elite athletes will have like 41 or even 60 numbers kind of even dropping down. It's amazing how much they can drop things. And it says here, check with your personal care physician for cardio workup if you're high risk. Consider short workouts with long rests to work towards your recovery. So instead of doing a hard cardio workout, you might be working out something just a little bit with a lot of recovery, because that's going to be the work, and then build yourself up to a harder cardio workout. Another one for heart measurements also to see how you're doing is your BMI, which is your waist to hip ratio, is a more reliable risk factor for cardiac vascular disease. Also, blood work with healthy iron level is important for your heart, as various studies show that both iron deficiency, too low because you're not getting oxygen and you're starving the body, and iron overload can cause oxidation and break things down. Think about eating things away, can be significant. Let's go into a little bit more of the biochemistry. So here's some factors of causing hypertension. You can see right here, stress and caffeine, nicotine, hyperthyroidism. There's going to be some chemical things here. We have a sympathetic increase, which is basically the flight or flight response. The adrenals kick in, and then the muscles react, they constrict, and of course they resist. There's more resistance there. There's your blood pressure. Sodium concentration. Insulin resistance promoting sodium retention. What happens with insulin resistance is it doesn't allow the insulin in due to high sugar levels, but other things can get affected by it. Sodium can be affected by it. Potassium can be affected by it. Here's magnesium being affected by it. This is what really starts to create problems, is this insulin resistance not letting things and major minerals to get in the body to work. Now, kidney disease can have an effect on sodium. Conditions that raise aldosterone. Aldosterone actually is a hormone that affects holding on to sodium. So the fluids and volume expand. There's more fluids to move. Then things have to work harder on the blood pressure. Now, vasodilation goes down because now things can stay constricted because if I don't do any physical activities, and physical activities can actually affect something called nitric oxide. We'll get into this a little bit later, but it actually helps, that nitric oxide helps expand the arteries. Vasodilation, blood pressure is a problem. And then excessive body fat. capillary to nourish body fats. It's applied to nourish. So now you got more tracks for the train to run on. Cardiac output for demand for extra capillaries and body fat increases blood pressure, let alone excessive body fat is going to be inflammatory in nature. Now, the arteries are the big player in the game here. And the endothelium on the inside part of the cell is where the heart disease originates. And we want to do things to make sure we promote this, make this flexible, make this work better. And this is where a lot of the nutrition elements come into play. And here we have the starting of a tear. And a tear can happen from a couple different things. And again, it could be from things in the bloodstream. There's other chemicals we're going to talk about a bit, oxidation processes and things of this nature. But when you get a tear, it's going to signal cholesterol and calcium to go there. And I said calcium to go there. And wouldn't it be nice to have something that actually pulls some of the calcium out of the arteries and soft tissue and put it back into bone or some other place? Well, this is where we're going to start talking about vitamin K2 and how much calcium is in our system. And you have to have the right amount because it needs to help you with muscle contraction. But also, on the other hand, do you have enough K2 to kind of move things out of here? And again, we have blood level basics here. Again, stress mechanisms, constricting, caffeine, maybe some sugar, smoking, and things like that, which actually oxidize and irritate the inside linings of the arteries. Tunica medica constriction, that's part of some of the layers that's inside the artery. Blood pressures go up. Tunica media, tunica intima, and again, constrictions could play a part. Nitric oxide plays a part. If the nitric oxide goes up, blood pressure goes down. If the nitric oxide goes down, blood pressure goes up. So on and so forth. Exercise, nitric oxide goes up as we showed before. Oxidation stress, when your body rests from the inside out. Reactive oxygen species is another term, but basically there is an eroding away of destruction, and oxidation is the term that happens with this. So we continue with oxidative stress here with heart disease. Antioxidants are ones that are atoms that have an extra electron to donate to silence the free radicals or the reactive oxygen species. And what happens, those guys don't have they don't have a paired electron, they have only one, and they scavenge and try to steal from others, so the antioxidant comes in. So a deficiency can play a part, and this can aggravate cell walls and also arterial walls. Refined carbs, again, the sugar things we talked about before. High intake of saturated fat. There could be some argument against that. There's some other things in the literature talking about about fats themselves, but the problem is the fat's rancid, like trans fats, partially hydrogenated. Hydrogenated fats are not good fats and they're destructive. Increase iron and ferritin. Iron in the blood. Ferritin is stored iron. Those can cause some irritations, as we mentioned before. Heavy metals can do some irritations. Myeloperoxidase, MPO, is more of a kind of condition. It's a genetic condition. Can have an effect that it has an effect that it can't kill yeast and some other things. It has how the neutrophils work in the body. It's a little bit more in depth than we can talk about here. Excessive exercise, and here's the interesting part. When you increase exercise, you increase mitochondria, which is kind of like the battery in your cells. That's great, but it also increases reactive oxygen species, and that's what's important. If you're going to increase exercise, you're going to increase your antioxidants. And the mnemonic ACEs, ACES, vitamin A, vitamin C, E, and S, being not a vitamin but selenium, those actually work as a good antioxidant to fight and help, like we talked about before. Obesity is an inflammatory element that's going on in the body. Smoking, as we talked about. Sunlight, too much, will create that kind of reaction, and radiation and chemotherapy. A little bit more about obesity. You have two hormones called ghrelin and leptin. Ghrelin gives you the feeling if it's stimulated and you want to eat, and leptin gives you the feeling that I'm full. And if you got insulin resistance, what happens is it blocks leptin, which in turn can actually block your feeling as you're full. So you keep on eating, which causes more inflammatory things. There are some individuals with leptin mutations, they're obese, but they have low blood pressure instead of high pressure. Just a note. And some more additional information on leptin. Sympathetic increase, constricts arteries, kidney damage, increased clotting, and decreasing nitric oxide, again, constricting arteries. Here's the big one, the cholesterol. And we have high density lipids and low density lipids and very low density lipids. And we think that these are the great numbers that tell us about heart disease, but I think they can actually take us down the wrong trail. You can have high density lipids, which are supposed to be good ones, but if you have one of the fraction ones here, you could have all bad ones and not the good ones of the fractions. Some are very good at doing the job and some are very lazy. Same thing with LDL. And what pattern of LDLs have? Do you have a very good pattern, like a pattern A, or do you have a pattern B for bad? And those are the ones that have a tendency to be more loose to block off into clots. Here's a set of definitions for you for the lipid panel that we just talked about, but I want to go into the next subfractions. Now, what a really good blood profile would be is including a VAP test, which is a vertical auto profile. And these fractions tell us something more in depth than what the other normal lipid panels do. And it's possible that your normal lipid panel looks normal, but then you have all the bad fractions. Or you could have one that looks bad on the lipid profile side, but it has all the good fractions. To give an example, the non-HDL cholesterol is a better predictor for heart disease than LDL alone. LPA, which is a little protein, little a. It is more dangerous than any other types of cholesterol and does not respond to traditional LDL lowering drugs. So you might be putting on a drug that's not going to work, but they put it on there, but they never checked this. Okay? IDL is often elevated in patients with family history of diabetes. And then the interesting thing is the LDL size pattern. Size B are smaller, size A are bigger. Now, what you're going to look at cholesterol actually is on the outside walls of cells. It keeps the inside environment away from the outside environment. But if you have not enough cholesterol, those leak. And oh, by the way, cholesterol is kind of like a template for all your hormones. And also you think about your brain, because a lot of the cholesterol that's there, that's for the brain's 60% fat. Where's that come from? It comes from cholesterol. So the A pattern is what you want. The B pattern has a tendency to be smaller and break away. Putting it all together, you have a metabolic syndrome, which includes elevated triglycerides, low HDLs, small dense pattern B LDL particles that increase the overall risk for heart disease. A better look at it. HDL2 and HDL3, these are subfractions used to predict cardiovascular risk. LDL2 is large and buoyant as the most protective form. But what happens if you have a whole bunch of the threes? It doesn't protect it as much. It doesn't take the cholesterol away. L3 is the densest VDL subtraction and confers a greater risk of heart disease than both 1 or 2. Wouldn't that be good to know? I put this slide in here. It's a hidden problem, one that people don't realize how important the gallbladder is, because that's the number one organ being removed nowadays. And the problem with that is it's the bile that's in the gallbladder is coordinated with the stomach to break down your fat soluble vitamins that are so important, D, A, and K, and E, that are very important for the health of your arteries. And if that's not there, or if it's taken out and you just let the bile duct from the liver just drip things in, you can lose up to 60% of your fat soluble vitamins. And they say it's no big deal. That's the number one procedure for having a problem with the gallbladder, and is to remove it. I just don't understand it fully. Now, congested gallbladder and low bile, bad liver, and another thing too is kind of like it's kind of backs up the heart. But if the liver's bad, and usually with the sad American diet, that usually has a problem. So it's congested, so it doesn't help the heart. Low stomach acid and acid reflux or heartburn. You don't get mineral absorption, and you need these minerals to kind of heal your body. Decreases, and the acids decrease with age, and also maybe possibly apple cider vinegar might help, or some other nutritional possibilities. A big factor in heart disease, strokes, again, going back to the artery. What's going on with the artery? And insulin resistance plays a big part. Is again, a response to carbohydrate and processed foods. Insulin resistance will block not only the insulin, but other things into it. And if you take a look here, it's regulated by magnesium, which helps relax those tissues. Insulin helps store magnesium. So what happens is now you don't have that storage going on. And high blood sugar damages vessel walls, So there's oxidation going on there, and this is the arteriosclerosis. And again, we have an increased peripheral resistance. The body has to work harder. And you can work harder, and you got tears. Bad things start to happen. Types of sugars are a problem, and especially high fructose corn syrup. And it's shown to produce uric acid, inflammatory, and decreases nitric oxide. Again, that nitric oxide is supposed to expand and not constrict. 7 to 8 times more potent at damaging blood vessels than regular glucose. Doesn't cause full feeling, and it goes right to, and seems to affect, goes right after, it doesn't say it here, but it goes right after, goes right to the liver. It limits to about 15 grams daily to treat. Usually, if you eat a banana, you're going to get about 18. A large banana is 18. Especially if you've got sugar handling problems, 15 or lower. Somebody who's really healthy, maybe 25, but I'd still trend towards the 15. Another molecule that destroys or irritates linings, and here's the homocysteine coming through and ripping here. And again, you're going to get, and when you get the tear in there, you're going to attract cholesterol. Cholesterol is just trying to make a patch, but it also draws calcium to it. And the amount of calcium, the hardening in that tissue can be a problem. So homocysteine, methionine to cysteine is kind of an amino acid exchange, has to do with B12 in your body and folic acid. And again, if this stays around your system, it's like a gumball running through your arteries making tears. Some more information on homocysteine. Direct toxic effect that damages the cell lining of the inside of the arteries, interferes with clotting factors. The oxidation of low-density lipids that are already there, and it's interesting to see the bottom one, the prevalence of arteriosclerosis, hardening of the arteries, caused by increased levels of homocysteine rise sharply in the years immediately following menopause, independent of age. Interesting. Another marker that can actually test from blood testing is heart-sensitive C-reactive protein. The higher the number, the more the risk. The lower the number, the better the risk. It's usually produced from inflammation circling around the body, goes into the liver. The liver then, in a reaction with the inflammation, creates this into the bloodstream, the C-reactive protein. I've had one person that had as high as much as 43. It also can be an indicator of other things. In this particular person, they're about to rupture their large intestine. Again, continuing, here it is, when elevated can continue to damage arteries. And you got to look for, if you've got something, where's the inflammation? It's an inflammatory marker. And then periodontal disease, a lot of teeth situations have H. pylori, sore throats, strep throats, pneumonia, any acute injury, arterial system when no other factor is found, heavy metals, iron, digestive problems will raise this number. You got to find why that number is high. Fibrinogen is another blood value, primary to occlude blood vessels, thereby stop excessive bleeding. Fibrinogen conditions can lead to excessive blood clotting and thrombosis, so it's an inflammatory sign. So here's some blood values. We already talked about the standard cholesterol panels. Electrolytes is a specialty panel. Hemoglobin A1C is how well your sugar handles over a period of time. Vitamin D is important. Hormonal panels are important too, especially things like estrogen and estrogen possibilities there. Homocysteine, fibrinogen, uric acid is inflammatory, and then of course there's, if there need be, this one generally doesn't need to be done unless you have kind of like extenuating circumstances. Again, if you really want to push it on the traditional side, echocardiogram, EKG, CT scan of the heart, the calcium score test would be good. The adrenal stress index is actually measuring how well your adrenal glands are in cortisol output in a circadian rhythm, which means over a period of a day, you're actually taking different spit tests to see where your cortisol levels are. Are they in the normal range? Mineral testing would be similar also to sometimes looking at some of your electrolytes. CMI testing we talked about, and calcium scoring tests we talked about. Here's a list of blood pressure drugs, what they're supposed to do. Calcium channel blockers, ACE inhibitors, beta blockers, diuretics. So you can read about them, what they're supposed to do. You should know what kind of class of drug you're taking if you're taking that, and kind of find out what it does. What kind of nutrition it depletes is another thing, because that's where we're going to go in the next slide. Now, there's times for medications, there's times for not. And I think a lot of times if we can stay away from the medications and let the body heal naturally as much as possible is probably good in the long run. And a lot of times the medications are strictly going after a symptom, going after blood pressure. Remember, I talked about essential hypertension, and they're treating something that might be unknown. They know 5% to 10%, and 90% is unknown. So when you're blocking natural processes, you're not supplying for the deficiency that might be causing that problem. Diuretics lose water, so they also increase blood sugar and cause dizziness and muscle cramps. You also lose potassium, which is very important for maintaining the high blood pressure down. So it's almost kind of like the diuretic. What are you doing at the same time here? Beta blockers inhibit sympathetic nervous system, and that's relaxing that fight or flight response. But the beta blockers, though, in turn, can cause constipation, fatigue, and upset stomach and dizziness. ACE inhibitors, which work on the kidney, blocks angiotensin 2, dizziness, fatigue, headache, and weakness. Calcium channel blockers. Some of the normal ones for calcium channel blockers would be magnesium, to use some of those things. And are we on this for the rest of our lives? Next, we're going to go and talk about stress. Now, this is where emotion comes into play. Sympathetic nervous system is kind of the fight or flight response of the body. And what it does is actually tries to put blood flow from digestive organs into your arms and legs so you can get away, thinking like you're running away from the tiger. But then it could be home or taxes or whatever that are doing it. And it can constrict the coronary arteries to some extent. And also this can lead to like left ventricle enlargement, so the enlargement of the heart in not necessarily a good way. And as the stress builds, we release a chemical from the adrenal glands called cortisol, and it's associated with systemic-wide problems. Leptin increases, blood sugar increases, there's weight gain, impaired digestion, mineral deficiencies with that, increased heart rate. And again, remember what I talked about. This is something that affects something called the vagus nerve. The vagus nerve is a nerve that's that actually touches all the organs of the body to kind of put them into coordination so I can run away. It's all about survival. But then if I do that, I can make my digestion deficient, and those things that I need to deal with long-term stress, those minerals I need to absorb, I can't absorb or be greatly reduced. Let's talk about structure. When we deal with something called the vagus nerve, it comes from the upper part of the cervical spine. There's 7 vertebrae. The first 2 play a part. And if we look at adjusting that area, we find that if we take the pressure off those nerves, physically take the pressure from the pinching of those nerves, we can actually lower blood pressure. So if we irritate the nerves, you can irritate it chemically, but physically if we irritate it, it can actually cause a problem too. It's like a double whammy. So actually adjusting those areas, and also adjusting sometimes the upper thoracic area where the nerves go from that thoracic means the rib cage. That upper part actually has nerves that go to the coronary arteries. So it actually looks like those 2 areas are very important. And I can see a lot of times that when we adjust, sometimes dropping down, as it says here, almost 14 millimeters on the systolic and 8 millimeters on the diastolic, and can be dropped just by taking the pressure off that and releasing tension in the body. And this is the reason why we take histories. It's interesting that those who respond above average to a cervical spine manipulation had previous trauma. Cranial motion, vagus nerve, kidney. Again, looking at that, kidney can affect the lungs. That's even lower down thoracic spine. The upper thoracic is going to be lung areas. Lower thoracic subluxation, higher supine blood pressure. The splenic nerve affects the renal plexus in the kidneys. Here's an article, The Atlas Vertebra Realignment and Achievement of Arterial Pressure Goal in Hypertensive Patients, a pilot study. Another study, Dr. Yates examined the effects of upper thoracic chiropractic adjustments on blood pressure in 21 subjects with elevated blood pressure. Results report that support the adjustment of the thoracic region significantly reduces blood pressure for patients with elevated blood pressure. So what can you do? Well, here's some answers. So the first steps in trying to take care of your situation is what kind of vascular stress are you under? You know, one of the things also, and we didn't talk, there's another way to kind of test omega-3s too. We have something called brain span. Wasn't listed in the notes here, but brain span is one to kind of measure omega-3s and how well your anti-inflammatory elements are. And how are your antioxidants, and kind of looking through and looking at history of what you're taking and how well the inflammatory reactions are happening in your body. What kind of inflammation and oxidative stress will actually be an effect of those antioxidants? And do we have any type of autoimmune disease? Because that's an inflammatory process. The body's constantly fighting itself. What is your nutritional status? What's your macronutrients? What's your micronutrients? What's your vitamins and minerals? Do a kind of like a functional intracellular assessment. Number one, subjective and possibly objective here. On the physical side, we look at the chiropractic and manual therapies, realign spinal and other joints. The axis atlas position it's very important because that's the C1, C2 area that's related to the vagus nerve. Cranial bone balancing can take some pressure off the skull. Jaw muscle therapy, same thing. Injury recall, it has to do with some emotional let go of stress and from past injuries. Trigger point neurological muscle therapy, and massage therapy. Acupuncture has been shown to be very beneficial for reducing blood pressure and associated symptoms, reduction in inflammation and stress hormones, improved scores on emotional evaluations, balancing energy of the body, shown to help relieve pain and help with sleep. Now, what's interesting when you talk about energy and electrical flow, and a lot of these items that are electrically flowed, that's what the needles do. They actually help move fluids from one place to another, inflammation from one place to another, calm things down. And acupuncture does a very good job of doing that. Still one of the best diets out there for cardiovascular disease and sugar handling, because they kind of go hand in hand, is the Mediterranean diet. These people are not eating tons of pasta. They're eating fresh foods from the local village farms. They have olive oils and those oils and breaking those oils down. Remember, we talked about the gallbladder. It's very important for those oils to be able to get into the system. And oils make things flexible too. So very, very important if you take a look at those diets. This again is from, as you can read from New England Journal of Medicine, taken from some notes from Dr. Mark Houston. There's some research that's suggesting intermittent fasting is decent. It helps fight obesity and type 2 diabetes, both of which are risk factors for high blood pressure. The body seems to be more sensitive to insulin and leptin receptors after a period of fasting. Many types of fasting regimes. One of the easiest to comply with is this eating schedule where you limit your eating to a specific narrow window of time each day. We recommend that you stop eating at least 3 hours or ideally 6 hours prior to bedtime to give your body a significant fasting period. If you're hypoglycemic, anorexic, or bulimia, this is not a time to actually do fasting. So that's not necessary for everybody. You should check with a clinical nutritionist or one of the doctors at our office to see if this is a good fit for your condition. Vitamin D, so important, and every time you get your blood work, you want to know what your vitamin D levels. Remember, you want to be between 60 and 80. Arterial stiffness, arteriosclerosis, are a driving factor for high blood pressure. As your blood travels from your heart cells into the wall of your aorta, called baroreceptors, they sense the pressure load and signal your nervous system to either raise or lower the pressure. Stiffer your arteries are, the more insensitive the baroreceptors become, and less efficient they become at sending the appropriate signals. Vitamin K2 lessens the negative effect of vitamin D on calcium. Well, what vitamin D does, it also helps you absorb calcium, but K2 takes it out of the soft tissue. But vitamin K is a fat-soluble vitamin, and if you don't break down the fats well, it's hard to get this extremely important nutrient. Very important slide, calcium connection. You need calcium, but you need it in the right balance. Calcium plaquing affects flexibility. To maintain electrolyte that contracts the muscle systolically on your blood pressure, and so from the Q to the R is where you see actually where calcium comes into play. When you go from R to S, this is the relaxation phase, which is controlled by magnesium. So too little or not enough contraction, you get not enough contraction. Sorry, there's a typo there. Too much contraction. Coronary calcium is one of the best predictors for heart attack. Again, looking at that calcium screen. Causes rigidity to the tissue, the calcium does. To lower calcium, 2 vitamins help transport, and it's vitamin K2 and vitamin D3. K2 helps remove calcium from soft tissue, prostate, liver, kidneys, liver twice, joints. K2 found in grass-fed beef, butter, yogurt, eggs, and cheeses. Also is, you can find them in fermented foods. K2 is fat soluble. Again, the calcium score test. Bile is needed to absorb fat soluble vitamins. If you got a messed up gallbladder, it doesn't help. So this is where multiple systems come into play. So problems with the calcium. And when it's increased, you can get anxiety, arrhythmias, high blood pressure, asthma, insomnia, bronchial spasms, cramps. Sometimes we do calcium for cramps, but sometimes too much could cause them to hold on. Increased urination, bone pain, constipation, soft tissue calcification, kidney stones, gallstones, plaquing of your teeth can be associated with too much calcium in the system. Now, this is the one mineral that's extremely important. Magnesium is important. The calcium, vitamin C, all these things are important. But this one, you need about 4,700 milligrams per day. We probably get half of that. And you can get in about 7 to 10 cups of vegetables, 4 to 5 times more potassium than sodium in ratio. It relaxes the nervous system. It softens the arteries. It prevents constipation, helps with cramps, helps with AFib in the heart. Diuretics have a tendency to get rid of this in the fluid, and you need to have potassium to take because of the diuretic medications people have. If you're salt sensitive, you usually need potassium. 98% of it's inside the cell. So one of the problems with taking it from a blood value versus taking a mineral analysis in soft tissue, sometimes you don't get the right picture of how much is in your cell because it's inside. It's an intracellular test versus an extracellular test. Normalizes heart rate. If you're deficient in it, it can cause tachycardia. Deficiencies also have with labored breathing and high pulse rates. It takes insulin to control and insulin to help absorb potassium. Now here's the thing on vitamin E. It's a complex, not an individual piece. It's not an alpha tocopherol. It means several different pieces. You want the full complex. A lot of the literature out there says how bad vitamin E is, but they're not using the full complex. Use the full complex. It's heart protective. It helps you absorb oxygen. It increases O2, prevents cramping of the heart, and it actually reduces high altitude discomfort. A lot of mountain climbers use a certain type of vitamin E too. It's good for acne, sex organs, menopausal women, and it's stored in the pituitary and also in sex organs. Helps prevent artery damage, which precedes a clogged artery. 8 tocopherols, not 1, make up the part of vitamin E. And you also have selenium, vitamin F, which is essential fatty acid, xanthine, lipositols, has vitamin E2 complex, good for angina pain. Refined flours and bleaching destroys vitamin E. That's why some of these grains are not so good. And synthetic is not whole food. You want the whole food piece, and then you're going to get the reaction that's supposed to get. Here's a great one, magnesium. It's a major electrolyte in the heart. It controls relaxation phase, so the diastolic part of the heart. So calcium does the contraction part, and the relaxing part is magnesium. Works with calcium and helps cleans out the receptor when the heart contracts. Works with potassium also. Considered a natural calcium channel blocker. And highest amounts are found in the left ventricle. With deficiencies, if it's relaxing, then the other thing happens. And so when you're deficient, arrhythmias and rapid heartbeats, stiffened arteries because it's also supposed to be taking calcium out, high blood pressure, angina, excessive calcium builds up because you're not controlling the calcium, mitral prolapse, overactive stress hormones. There's something called magnesium red blood cell test. It's an intracellular test, so you have to go inside the cell, like the omega-3 test that we have in brain span. This is a different test that you have to order in blood work to be done. A little bit more expensive. That's what it's generally done, but it really gives you the true element of how much magnesium is in your system, not in just the regulars floating around outside the cells. And in plants, the main mineral in chlorophyll is magnesium. So when you're doing the stress part of therapy, you want to look at things like Tai Chi, some things that you move. You get oxygen moving, you're moving at the same time, you're focused. Same thing with yoga. Transcendental meditation is one of the best ones. I'm sorry for the typo there. It's one of the best ones to actually to control yourself, to get into that focus zone, to get into what they call delta D, which is that relaxing phase, brainwave phase, to the best way for the body to heal. Heart math we'll get into a second. There's other things with biofeedback. We're going to be looking at trying to introduce something called brain tap, which is also something that affects the sympathetic versus parasympathetic waves of the brain. On the stress side, again, HeartMath is a biofeedback. It works really, really well in regards to determining if you're stressing out or not. And sometimes you think you're not, but it's a device that actually attaches to your cell phone, and it'll give you a feedback to see if you're in a kind of like a mood ring. Is my reaction being too stressful for my system? And if it is, then you do some deep breathing exercises, you do some biofeedback, you follow a pattern maybe on your cell phone for a minute or two to kind of bring you back down and straighten these things out so you're not irritating the body with huge amounts of cortisol rushes. And we have another brain tap when we're going to be slowly bringing this into the office. We're not ready yet. It's probably about a month or two out. It's one that actually can create a calm focus that's just right for learning. Each session is designed with brainwave balance in mind. Even if with weight loss, you actually have a certain type of brainwave focus that you want to be in when you sleep, delta D, alpha waves when you're awake. So it tries to use stimulation of your eyes and sound and other forms of stimulation, music, to kind of get the body into the right phase it needs to be in and not in this constant flight or flight stress reaction. One of the best ways to get the body relaxed is deep abdominal breathing. That means get that stomach or the diaphragm to drop as far down as possible. A good deep breath in. I always find it's very difficult to say something stupid after a deep breath. It keeps me out of problems a lot of times that way. So abdominal breathing, really effective on the vagus nerve and kind of relaxing that thing and puts you in the proper state so you can think better. When you're stressed out, you don't do critical thinking. It's more flight or flight. I want to get out of there. And if you're trying to get a job done, and if you're stressing like that, you'll lose productivity. You'll probably make more mistakes. It's better just to take a deep breath, go through and take your time, and you'll find that you might be more productive. Exercise is excellent. It's shown to have strong antihypertensive effects on the body, so you get that blood pressure off those areas. Loss of visceral fat, elimination of stress hormones, increased parasympathetic activity, break down, use up the blood sugar, helps relieve stress and improve sleep, detoxification, anti-inflammatory. But when you're exercising, you have to be smart about it. If you have previous damage, you got to work into it slowly. You must be cautious if you have high levels of hypertension. And, if you're diagnosed with that hypertension, especially if you're above 160/100, and pre-hypertensive is between 120 to 140 and 80 to 90. If you got to, then work with your primary care physician and to make sure that and also the calcium scoring tests would be something to kind of take a look at. So do you have some things here? Can we do some other additional tests to find out what's the state of your damage before it goes any farther? Many types of exercises that are available. Here's one that a lot of people don't think about. It's 4 weeks of isometric hand grip exercises can reduce blood pressure. Interesting report on the hand grip exercises in AARP here that they said that while all exercises did good things for blood pressure, some of the most impressive improvements came after 4 weeks after hand grip squeezing. AARP suggests squeezing the gripper for 2 minutes at a time for a total of 12 to 15 minutes, three times a week, and you can get one at a sporting goods store for about $10 to $20. Again, working it slowly, depends on your condition, physically sound, full cardio exam with stress tests if needed, aerobic, anaerobic, cross-changing, changing up muscle groups is always good to get as many muscles going as possible, proper warm-ups and cool-downs. So if the body is clear or ready for high-intensity exercises and you've done the appropriate checks to make sure you're okay, and there's a couple different ones. There's a good, strong cardio workout. There's high-intensity interval training, which actually has some very good benefits, where you have a better recovery time. You're on and off for 30 seconds on, 30 seconds off. Has some very, very good positive factors. One such for both of those exercises is the growth hormone here. And you reduce body fat, you reduce recovery time, you can recover easier. Your hormones come up, steroid hormones come up, muscle mass, bone density. You have different things like here on the nitric oxide, transport in blood pressure, circulation, recovery, brain function gets better. And that's epithelial nitric oxide. There's a neuronal nitric oxide. Brain function increases. Neurodegeneration goes down. The degeneration in the brain goes down. The only bad one is the oxidative stress here that comes from the inducible nitric oxide, and that's the one where you, even though when you exercise, you increase even like mitochondria number in your body, which is the cells of your batteries to your cells, but you do create free radical formation. This is where you want to increase antioxidants here. As for the rest, if he goes over there, cardiac contractions, improves heart health, minimizes stress response. You stimulate serotonin, which improves mood. You stimulate dopamine, improves focus, and improves motivation. The GLUT transport here improves insulin. Energy goes up, fats go down, blood pressure goes down. Opioid response, decrease in pain, improves mood, activates T regulation cells, improves self-tolerance. High-intensity exercise, HIIT, high-intensity interval training, is an exercise interesting because you can only maybe do it for 10 minutes, or the person who's on the go doesn't have a lot of time because you're going to take about 2 or 3 hours every time you go in and go exercise. You got to get there, get back, clean up, blah, blah, blah. But this is interesting because it's 30 seconds on, 30 seconds off, but it's almost equivalent to like doing an hour workout. It can be done at home. And the ABCT of it is aerobic. It builds the body, contours and tones. And again, if we're looking for antioxidants, as we build some of these things on, the vitamin A, C, and E, and selenium are very, very important. Know your limitations, and again, you may need a stress test to advance. So there's ways to control this in different ratios of the time that you do it. Just be cautious with it. So I want to review on some of the things. We talked a lot of different elements here. The vascular part of the body, which is important. When you have clogged arteries or calcification, you're going to probably be low in vitamin K2 and probably low in vitamin C too. Now, vitamin C we didn't talk too much about, but it's very, very important. It rebuilds the tissue. It's an antioxidant. It's in the ACEs type thing we talked about too. So it's very important for the vitamin C there for the health of those arteries. Blood pressure is low. It's probably low vitamin. The blood pressure is too high. Then you have probably low potassium. Maybe too much higher sodium, and possibly looking at insulin resistance. You might be handling your sugar problems. Valvular problems. We have murmurs, enlargement of the heart. There's another one we didn't talk much about is low B vitamins, and especially B4. Now, B4 is a vitamin that you don't necessarily see. You hear like B1, B2, B3, and then there's B5, B6, and B12. The problem being is it gets processed out, and this is something that's in certain types of foods. There's going to probably be in some type. The wheat germ part of it is actually taken out. Wheatgrass is something that usually has some of this in it. It actually helps very much with maintaining the tone of the flaps of the valves. Electrically, arrhythmias, probably low magnesium, low potassium, high calcium. High pulse rate, probably low potassium. If you got low pulse rate, probably low adrenals and low salt. Muscular, heart muscle cramps, low vitamin E, antispasmodic, and then coronary artery constriction spasms, low adrenals. And you got to be able to see if you can have something to help to assist those. And where are you going to get these things? Potassium from veggies is the best. Magnesium veggies, remember the chlorophyll. Sodium, sea salt, Himalayan sea salt, not the sodium chloride. Calcium, leafy greens, veggies, and dairy, but good quality dairy. Get it from sheep and goat cheese. Vitamin B4, avoid sugar. Nutritional yeast with no food additives. Vitamin K2, grass-fed animal fat. Egg yolks, dairy, also getting into fermented foods. Vitamin D3, sun, fatty fish, dairy, egg yolks. Vitamin E, green leafy veggies. So we know that nitric oxide is good because it kind of helps dilate the arteries, helps with taking a warm bath, breathing in and out through one nostril, close off the other nostril and your mouth. That actually can stimulate nitric oxide. Eating bitter melon, rich in amino acids, and has some vitamin C. And we know how vitamin C is protected for those arteries. Well, you should talk to one of our nutritionists and work with us or work with the doctors in nutrition. The key thing here is also balance weight and blood sugars, eat a proper diet. You want to avoid things like wheat, soy, corn, dairy, sugars, All processed foods, frozen meats, fast foods. Most restaurants have these because, again, you can't control the cooking. Sushi, ready-to-eat meals, sulfate foods, preservatives, dairy, fruit drink, breads, and alcohol. Sugary foods, drinks, and carbohydrates, all sodas, fruit juice, cakes, cookies, candy, ice cream, pasta, bread, crackers, chips, all the above. What am I going to eat? Eat a diet based in high-end vegetables, raw or lightly cooked, quality meats, grass-fed organic, water from good sources, good quality fats. I mean, the people who live the longest are usually have some type of either fish oils or having anchovies, fish, salmon, those kind of things. They have fresh pressed olives, olive oil, and look at them. They're in the Mediterranean. Those are the healthiest people. Some of those in Italy and in Greece. And if not, they're Costa Rica, but they're on the shore. Okinawa, Japan, they're on the shore. The seventh Adventists out of California. These are all these people in blue zones. Have good quality places where they're eating good quality foods and not a lot of stress. And you take a look at them, and they have some of the longest living people in the world. Again, some additional steps. We've already talked about eating real foods and sugar intake. The interval training is also a good thing. Just good to remember. Good restorative sleep. You got to get some sleep in to rebuild the body. And actually, it's one of the ways to fight inflammation. High quality animal-based omega-3 supplements, which would be good. Right foods for your unique nutritional type. And we didn't talk much about that, but everybody has their blood type. There's a different filter to put in to find out what is exactly the right type of nutrition that you should be doing or for your body type. So there's A types, which are more vegetarian. There's O types, which are more protein eaters. It's important to be able to eat the right type of diet for you. So that's actually another form of filter for yourself to be customized for you. Allergies is another one. I mean, it could be a good food that you're eating, but you can have an allergy to it. And that can cause inflammation. That doesn't help you with this cardiovascular stuff either if you have inflammation in the body. So body type, am I alkaline or am I acidic? So some of those things can play a part there too. A comprehensive exercise program, including strength training, core exercises, and stretching. The HIIT could be part of that. It might be something that might be easier, depending if you're a stroke victim. If you're a female, you might have something that might look easier, not so hard pounding on the cardio. And optimize your insulin levels. And some more additional maybe foods or supplements to look at. We've talked about vitamin D enough, L-arginine, affects nitric oxide, olive leaf extract. It's another one, CoQ10, the mitochondria for the heart. If you take a statin drug, you should mandate that you have CoQ10 in your system. Magnesium, we talked about. Garlic has some anti-high blood pressure and good cardiac effects on the body. Probiotics is very good. Kidney, liver, adrenal support. Potassium, we talked about. Selenium, a little bit. Also helps form glutathione, antioxidant, sesame seed, and green tea. I can't hop on sugar enough. The high blood pressure associated with it, sugar gets converted is usually by triglyceride to cholesterol. Potassium deficiencies because of the insulin resistance. Stiffened arteries, sodium retention, vasoconstriction, high blood pressure, everything to the left. Basically, that's the insulin resistance symptoms, the metabolic syndrome. It's just going to mix them up, but you still get the drift. Sugar, Tom and I argue back and forth on this, but I think sugar is the number one, public enemy number one, because how much it affects cardiac disease. Didn't get into inflammation as much, but again, inflammation does play a part here. In alkaline foods, there's foods that are alkalining, and usually vegetables are going to be that way. Proper hydration, eliminate caffeine, fish oils, ginger, turmeric, anti-inflammatory, very good. Vitamin D again, bromelain, anti-inflammatory, pineapple, quercetin, apples, tomatoes. Also a good one for anti-plugging, especially involved with COVID-type problems, rutin, asparagus, lime, lemon, orange, grapefruit, and buckwheat. And now all you need to do is take action. Now we have a special offer for you tonight. It's a 2-day visit at our office. And for instead of $225, it's $99. Now, usually what we do when somebody comes in, we give them, it's an examination. We check your vitals, take your history, take the blood test, and also blood pressures in 3 different positions. Check the adrenals and how they are functioning that way. We do a specialized EMI test that actually looks at acupuncture points. We'll see if there's a need for things like brain span or other lab work that needs to be done. Get hold of your old blood work, which is important, and take a thorough history, nutrition aspects, emotional aspects, and structural aspects, see what's happened in your body. And the first day is a gathering of information, so that's what we do. The second day is actually putting together, hearing it a second time for you to understand what's going on and how we can help you. And that's how the second part of it plays. Now, instead of $225, this is going to be $99, and I'm not going to collect the $99 myself. It's going to be put into a charity called Caring for Others for people who cannot help themselves, at least don't have the money or the ability to actually pay for additional help or the help that our office can give. We can also do a scholarship, and a scholarship for people who are looking to advance their learning and in ways that maybe they might not have the money to be able to do so. Also, educational resources for the community, putting things in for people so they can be able to what's the term I'm looking for? Be able to eat, even like a food bank and that kind of thing. Also for Christmas, giving something for the children of that time of year. Make sure they have something coming into the cold months of winter. If you're ready to take a step or you want to do something for a friend, this would be a good gift for them. And from that, I want you to thank you for taking your time. And hopefully, this will make a difference in your life. Thank you.